that, like we've said before, the outbreak, this virus likes the possibility of close quarters, and whether that's at the home or whether that's at work, we need to ensure that we make sure we prevent these outbreaks from happening. So we need to find out a little bit more to be able to give a more well-rounded answer.
Now we will go to Bayram Altug from Anadolu Agency. Bayram?
Hi, can you hear me?
Yes.
Thank you very much for taking my question. Good afternoon, all of the people there. My question is also related to Italy. Professor Alberto Zangrillo, head of intensive care at Italy's San Raffaele Hospital in Lombardy, has said that the new coronavirus is losing its potency and has become much less lethal. He said that COVID-19 mutates over time and hopefully one day will become a common cold virus. It can also be noted that while the number of cases broke a record in recent days, there is no serious increase in the number of deaths. In the light of this data, do you think the virus is really loses its effect? Thank you.
I will begin. So thank you for this question. We've mentioned before that there's a large number of virologists and scientists that are looking at this virus as it emerges in all countries. And I just checked today, and I saw there's more than 49,000 full genome sequences that are available that we're looking at to determine if there are changes in the virus. And as this is an RNA virus, there are changes, expected changes in them, and we're trying to determine if those changes have any impact on the way that this virus behaves. We haven't seen that yet, but we have a group of people globally who are looking at this to make sure that we are paying attention, to make sure that all of the viruses that are shared, and we're grateful for countries for sharing these sequences, determine if any of those changes will mean a different change in behavior. In terms of the potency of the virus, it's an important observation that you mentioned, and we will look into it. But we should highlight that this virus is very deadly. When it does have a chance to infect people, it can kill people. And so we want to make sure that everyone treats this virus seriously and make sure that we do everything that we can from preventing infection, and then from those that are infected to prevent those individuals from developing more severe disease.
Yeah, and if I just might add, thus far at least, there is no evidence that of all of the sequences that have been generated and all of the different infections in the world that we're seeing any strain of the virus emerge that has either greater or lesser lethality or clinical impact. In fact, the virus, most mutations in viruses provide no biologic advantage to the virus, and in fact most are detrimental to the virus. But in some cases, just now and again, this is the process of evolution for all DNA and RNA-based organisms. Just now and again, a single mutation or a few mutations can result in the virus changing. And what we're always watching out for is any change that changes the clinical impact of the disease, makes it less or more virulent, but also changes that might reduce the effectiveness of therapeutics or vaccines, or that might affect transmissibility or likelihood of transmission or the route of transmission, or in this case too, changes to the virus can reduce the effectiveness of our testing, because our tests are based on recognizing very often the genetic sequence of the virus. So we constantly monitoring the genetic sequences because it can affect diagnosis, it can affect treatment, it can affect vaccines, and it can affect the clinical impact of the disease and the patterns of spread. So because of that, we maintain very strong vigilance with the network of virologists and others around the world. In fact, I think within the laboratory working group there is, Maria and the team have put together a very specific group of virologists and genetic experts who are constantly reviewing the sequences and looking out for exactly those signals that you mentioned. But with regard to the real-world observations, we are not observing a significant difference in behaviour of this virus in any of the areas that I mentioned, either in terms of its transmission, its clinical lethality, in our diagnostic capacities, nor in the impact of therapeutics.
Thank you, Dr. Ryan. We will now take a question from Sophie from South African broadcaster. Sophie. Sophie, can you unmute yourself, please?
Is around yesterday, the announcement that the WHO recorded a highest number yesterday around the world. I just want to find out, if you were to attribute this to something, what would be the reason for these high numbers that were reported yesterday? And also perhaps which countries contributed to this high number?
I can begin. The DG or Maria may wish to add. Certainly the numbers are increasing because the epidemic is developing in a number of populous countries at the same time and across the whole world. So from that perspective, a large number of countries are contributing to that overall increase. Some of that increase may be attributed to increased testing. Countries are testing more, and certainly countries like India are testing more. But we do not believe that this is a testing phenomenon. Clearly, when you look at hospital admissions are also rising in a number of countries, deaths are also rising, and they're not due to increased testing per se. So there definitely is a shift in the sense that the virus is now very well established at a global level. It has reached some of the most populous countries in the world, some of the most populated areas of the world. And because the epidemic is now peaking or moving towards a peak in a number of large countries at the same time, you're seeing that impact on the number of cases. Now, in Europe, in Western Europe, you're seeing the curves decrease. In Southeast Asia, you're seeing the curves decrease. And then the overall numbers increase, which clearly means the Americas are contributing, South Asia is contributing very much, but also there are countries in the Middle East and there are countries in Africa that are also contributing to that overall increase. So the situation is definitely accelerating in a number of countries with larger populations, and that is most certainly contributing to this overall increased number. Maria?
Yeah, only to add, if you want some specifics on the case reports every day, we do have a dashboard that's online where you can look and see the actual numbers of cases and deaths that are reported, and you can break that down by countries. So you can get by regions and by countries. So that can give you some granularity if you want to see where are those actual numbers coming from. And it's on our main WHO website.
Okay, we have time for a couple of more questions. Ana Pinto from Folha de Sao Paulo. Ana?
Yes, thank you, Tariq. Dr. Ryan, last week you said there were signs that COVID was stabilizing in Brazil. I would like to ask if you could elaborate a little more on which are those signs and what the trend is now, if the signs are still pointing to stabilization in Brazil. Thank you very much.
Well, I think, as you know, Brazil has surpassed 1 million cases and just reported a record, I think, 54,000 cases in our last 24-hour reporting period. Some of that may reflect changes in reporting, as there was a lag and the change in the systems reporting, I believe, from the state level. So some of that is potentially architectural. But if you look at the number of cases over the month of June, they've remained relatively stable. What you see is a kind of a stable weekly pattern, a decrease at the weekends. And it's not that the disease decreases, reporting changes. But there certainly has been a spike in cases in in the last 24 hours. And again, we're looking into how much of that is artifactual or related to reporting and how many days that reflects going back over the last week. Because on Wednesday, Thursday of last week, the number of confirmations from Brazil was actually below average. And now we have a very much an increased number, which may reflect it's above average. So we're looking into that with our colleagues at the Pan American Health Organization, our regional office for the Americas. The states with the highest number of cases are still Sao Paulo, Rio de Janeiro, Sierra, Para, and Maranhão. And the number of cases at Sao Paulo are approaching 212 million, or 212,000, I'm sorry. But there still is relatively low tests per population, and the positivity rates for testing are still quite high. If you look overall, in epidemiologic week 17, I believe the positivity rate was 31% for Brazil. So that generally means that there are probably more cases out there than are being reported. What we tend to see is that positivity rate dropping, usually down to 5% or less in countries that are detecting all of their cases and that are in effect over-testing. So from that perspective, we would say that this trend or these large number of cases are not reflective of exhaustive testing, but as I said, probably underestimate the actual numbers of cases. So while the overall pattern of disease in Brazil, as I said last week, is overall flat, the number in the last 24 hours needs to be examined carefully, but also we need to look at the fact that, as I said, up to nearly 1/3 of all tests are positive, which does indicate that there is under-detection or under-reporting of cases overall.
If I could just add to that, it's not specifically about Brazil, but when we look at any case numbers in any country, it's really important that we break this down to the lowest administrative level as we can. The virus doesn't take hold evenly across all countries. There may be differences in intensity of transmission by a state or a province, but then even more importantly, it's to break that down even further. Where is transmission happening? Is it happening in healthcare facilities? Is it happening in these expat dormitories that I mentioned previously? Is it related to specific events? Is it in certain vulnerable populations like long-term living facilities? We need to break down the cases to an understanding so that we know how to tackle it. And when we look at the national level, it's very important to have that national number, and Mike has outlined some of the reasons we may see some differences, but we need to break it down and understand where transmission is occurring, because this will help us control it. You've heard us talk before about these 4 C's, where we go from no cases to sporadic cases, clusters of cases, and community transmission. And what we're aiming to do with the testing and isolating and caring for cases and contact tracing is to bring transmission down from community transmission to clusters. And once we understand where those clusters out, to bring those under control and move that back down. And so as much as we can, and this may be very difficult, especially in countries that are experiencing community transmission, is to really break down our understanding to the lowest administrative level as we can, and use our resources where they need to be used most intensely based on that epidemiology.
And if I could add, Tariq, because I answered the question directly in relation to Brazil. I don't want anyone to get an impression that I've singled out Brazil. If we look at Latin America in general, Brazil, if you count those numbers, the increase in numbers reported yesterday has about a 25% increase overall in the week. But if we look around the region, Chile has had a 41% increase in cases in the same time. Argentina has a 38% increase. Colombia, 35% increase. Panama, 26%. Bolivia, 33%. Guatemala, 39%. Honduras, 38%. French Guiana, 86%. Costa Rica, 28%. El Salvador, 24%. Haiti, 26%. And Venezuela, 25%. So what we're seeing is still in Latin America is an evolving epidemic in the region. that's affecting all countries. And certainly Brazil, as the most populous country, is deeply affected, but it's amongst many others. And we've also seen worrying increases in deaths in the same period in some of those countries. So from that perspective, I think it's important to see Brazil in its regional and in the global context. Just to be sure that people don't misinterpret that in responding to a question specifically on Brazil, that we're not conscious of the regional or global context and the place that Brazil sits within that.
Many thanks. We will take our last question for today. We have Pian from NPR. Pian?
Hi, thanks for taking my question. There are reports of minks being culled on a farm in Amsterdam over concerns that they could be an animal reservoir for the coronavirus. So I wanted to ask, what do we know now about animals and humans transmitting the virus between them, and how does that inform our approach to suppressing the virus?
So thanks for the question. Yes, well, we have a team that's working on looking at the animal-human interface and looking at the susceptibility of animals to this virus. You know about the work related to the origin of the virus. What I'm going to mention is specifically about the minks that you mentioned, and indeed there are some minks that have been found positive in the Netherlands and in Denmark. And what we understand from these investigations that are currently ongoing is that they were individuals who infected the minks, so people who infected the minks, and in turn some of these minks infected some people. It's very limited in terms of the transmission that is happening between the people and the minks. And some of those minks have been killed. We are learning about what this actually means in terms of transmission and what role they may play. I should put this in context that this is a virus that is predominantly transmitting between people through respiratory droplets, and this is the driver of transmission. This gives us some clues about which animals may be susceptible to infection. And this will help us as we learn more about the potential animal reservoir of the COVID-19, of the SARS-CoV-2 virus. There's a number of studies that are ongoing looking at the animals that are susceptible, from minks to ferrets to cats, dogs, pigs, and so there's a large group of scientists that are trying to better understand the role this virus plays. But again, just want to put it into context of the fact that this is a human-to-human transmission primarily that we're seeing, and why we're seeing this virus spread globally.
Thank you, Dr. Van Kerkhove. We will conclude our press briefing with this last question, and remind you that we will get the audio file to you shortly, with the transcript being posted tomorrow. I wish everyone a very nice evening.
Thank you. Thank you, Tariq, and thank you for joining. And see you on Wednesday.